with my gua sha therapy routine. I'm loving it. Loving it.
Yeah. Yeah. I learned it from oh gosh, what's her name? Sandra Lanshin. Do you know who that is?
No, who is she?
She has a practice in New York and she flew out to LA to give a workshop on it. She's an acupuncturist too, but she does I think she might be an esthetician too. So she kind of does both. And so she did a workshop on guasa and like, the whole protocol and everything. And yeah, it was
It feels
awesome.
so good. Like I get this. I'm in the car because I had to drive up to Stark, Florida, which is like this little country town about 6 hours away from where I live in Miami. And I
Oh,
have my little tool, and normally I like to start my routine in the morning, but I thought, while I'm driving, I might as well just stimulate my facial meridian.
yeah. Especially right here because it gets so tight all the time,
I get
Right in there.
PMJ, and so
Mhm.
it just feels so good and it's so relaxing. And I just really think that it's an easy way to, stimulate all of your meridians and all of your organs. And, this is our face. And so we get facial diagnosis right from here. We know what's going on. And as you can tell, I've been dealing with some melasma issues right here and on my face. And I've been
I
using
can't even tell.
oil. You can't even tell? Oh,
No.
me. And the gua sha therapy just really brings the blood supply, produces collagen production, and just I feel it's just really starting to shift that stagnation that's there.
Yeah.
So thanks for noticing. And
Yeah, it's awesome. I love guasa.
as a matter of fact, since I have you here, tell me, in the chakra system, we have a chakra system interface, and I know that this is like the kidney area in Chinese medicine. It's also the root chakra. So is that do you practice that too, or do you tell your clients about like where on the face is the ovaries related, or do you have recommendations on
Um, no, I normally just do the whole face because I like to do like a whole body approach kind of a thing. But I do have a map that I give them actually that shows all the organ systems on the face. Here, let me see. I'll have to show it to you.
I'm glad you said that because, when I use essential oils, I read a lot of information about the foot and how you put oils on the foot, and it says, "Oh, for your thyroids, put oil on the big toe at the crease." And I'm just kind of like, just put it all over the foot.
It's too specific.
I know,
It's
it's
too
so
specific. Yeah, because then you get kind of detailed and it kind of defeats the whole purpose of being more symbolic and general and big picture, instead of like all those details. But yeah, I have this, I don't know if you can even see it.
Is that on your Instagram?
It is on my Instagram. And
Okay.
so it's her face and then all the organ systems on the face. But
Yeah.
I just tell them this is all the stuff that you're taking care of when you do your whole facial guasa. Yeah. And then the reproductive organ seems to be like right under here actually. And in facial diagnosis, I know that I think her name is Lillian Bridges. She does the facial diagnosis. Is that right? Lillian Bridges?
I have to look her up. I should reach out to
Yeah. But she says that you can feel right here. And if you can actually feel like your blood vessel under there, that's a sign of fertility.
like
Yeah.
you're fertile.
Mhm.
What?
Yeah. 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 So like right here, if you push in like really gently, and if you feel like, first of all, if you feel warmth, that's good, right? That's like warmth in your womb. And then if you eventually feel like a pulse there, that's a sign of fertility.
The pulse indicates that you are
Fertile. Well, not necessarily pregnant, but that you're in a state of fertility. So probably like you're ovulating or yeah.
oh, cool. So wash on that point can really stimulate fertility.
Sure. Yeah.
And I can see how that relates because when we're looking at the Ren and the Do channel, this is like the reviving point. Just
Yeah.
so, you know,
Wake up. Yeah.
yeah. I love this. I love the anatomy. It's just like
Yeah. Everything seems to kind of come together, huh?
I love it. This is like takes medicine to the whole new next level. It's just the Chinese were brilliant. Brilliant.
Absolutely.
So
what are we going to talk about? We're going to talk about, I don't know. What do you want to talk about?
I just love being on this broadcast with you because before I get on, I'm just like, oh man, I need to ask her this question and that question. And, I've been working through your e-course, which has just been amazing. And I can't wait to like continue sharing what you have to offer. You're just so beautiful and gracious and generous and your delivery. And you basically translated the Chinese philosophy in a way for us, Westerners to understand and take care of our bodies well before a gynecologist can identify deficiencies. So I just want to put that out there. But today I thought we could talk about fertility.
Sure.
A lot of my friends are pregnant. They're wanting to get pregnant. And I think that there is a curiosity around how to have twins, how to stimulate fertility. So what does Chinese medicine say about fertility? And
yeah. So the way that I like to explain fertility is that it's not only for babies. Like fertility is not only for the function of procreating. Fertility is living your most vital life. Because when you actually work on your abundance and vitality, then it translates into fertility and vice versa. So you can have that goal, very narrow goal of like, I want to improve my fertility. But in essence, what you're doing is really living your most vital life. Yeah. So.
So when you say living your most vital life, what does that really mean?
So we all have our ebbs and flows, but in general, what you want to experience is sustainment, sustainability of your energy, sustainability of your digestive function, and a lot of times we depend on a lot of things externally in order to keep going. So like caffeine is one of them, or drugs is one of them, to stay out of pain and so forth. So those things are not necessarily sustainable because eventually they're going to tax your body so much to where your body can't even function optimally. So what I like to say is kind of living vitally is that there is this access to your own inner pharmacy inside. So you realize that your temple, your body has certain functionalities that need to be maintained and tuned into, and almost like, your car has functionality and it works optimally when all those things are kind of taken care of properly. And so if you eat properly, sleep properly, follow the natural rhythms, then all of your functionality can work optimally, and then you can actually sustain that and maintain that, throughout your lifetime. Yeah, and that's living in vitality.
So that is a key factor in becoming fertile. And so it's not just about the way you eat, but also, we were talking about our cycle and knowing our cycle and nourishing our cycle, because all of these things are going to increase fertility and ovulation, right?
Yeah. So I think a lot of times when we see patients in clinic, it's kind of like their last go. It's like their last resort. They've been to the doctor, they've tried to have, conceive naturally with their partner for several years, and there's just no success. And so there's this really kind of tunnel vision at that point, like, we need to get pregnant. Let's fix this. And there isn't like this kind of global view on your life in general, your vitality. It's almost like the whole idea and goal of getting pregnant supersedes how you are doing in your body, your temple. And so all these things are then being done to you. You're being injected with hormones. You're being put on all these things without even taking into consideration the state of your being, of your body. And so then maybe you do get pregnant, but then what happens during pregnancy? You might not be well. And then postpartum, you might not be well. And so I really think it's important when somebody is considering conception, they consider themselves in the process. You know, it's going to be absolutely beautiful and wonderful to have a baby, but consider your well-being in that process. Yeah.
So this is planning.
Yeah, it's
day of conception.
planning. Yeah, it's planning, but it's a little bit broader. You know, it's like, yes, let's prepare your hormones, you know, for, you know, proper conception or whatever, but how's the state of your whole body, you know? Yeah.
That's right. So I have to ask this question. My friend asked me, she's like, so I want to get pregnant, but I want to have twins. Can acupuncture make me super fertile so I release 2 eggs instead of 1 so I can have twins?
I'm not sure about that. I mean, there's all kinds of old wives' tales and stuff like that to really boost your fertility, eat certain foods, take certain herbs, that kind of stuff. But there's absolutely no guarantee that, you know, you're going to get twins or triplets and stuff like that. I think the only kind of surefire way that would probably happen is if, you know, like 2 eggs were, you know, fertilized in vitro and then inserted into your womb and stuff like that. But yeah, I think there's a lot of stuff that you can do, but hopefully she won't be disappointed, you know.
I told her that I can help her feel more organic and in the flow as she approaches the process of fertility. Another question that I often get is women who want to have a baby. They're having a hard time getting pregnant. Like, how much time, how many treatments does it take, and what is actually happening to the body when it's not able to get pregnant when the woman wants it?
So I think an important thing to point out here is that it takes 2 to have a baby, and I feel like women do take on that burden and that guilt that it must be something going wrong with their body. So whenever I do treat a couple for fertility, it is the couple that I treat because it matters on both sides. And it's treated differently on both aspects, you know. So that's, I think, really important to kind of point out. It's a team effort. And so, you know, when pregnancy is not occurring, I think the woman automatically thinks that it's something having to do with her body. And I do think that it's important to address those things that could be possibly the reason. But I also think it's a really good opportunity to open up conversation with your partner and say, hey, you know, let's kind of go in on this together. You know, it takes 2 to have a baby. You're an important piece in this equation, kind of a thing. And can we do this together? You know, as if it is, you know, unexplained fertility, it's just that, you know, on the Western side, there's no reason why pregnancy should not occur. You know, a man and a woman goes into the office, they get everything checked out, sperm count, motility, everything is just fine. And on her side, her tubes are completely clear. She's ovulating at the correct time. But I think what they kind of miss on the Western side is on the woman's side, and then I'll talk about on the man's side in a second, but on the woman's side, they don't consider and look at the menstrual cycle as a vital sign. You know, if she's getting her period every 40 days, you know, that could be an indication that could throw off when she actually ovulates. that's something to consider. And so regulating the cycle would be really optimum, so that you can predict, ovulation time more correctly, right? And then another thing would be that the color, what is the color of the menstruate? And so it's actually a vital sign. So if it's something on like a darker color, that could be a sign of lack of circulation. If she's having so much pain and clots and other kinds of conditions like PCOS or endometriosis or fibroids, all of those things need to be considered. And those are factors in the unexplained fertility, so yeah, all of those things matter,
Yeah, that completely explains why in Chinese medicine we have to peel back those layers. Women who want to get pregnant, they go through infertility because they don't understand why their body is not naturally becoming fertile. But in Chinese medicine, we say, okay, we look at your pattern and we find out what's going on, where we need to start treating the body, how to get it back into balance. And so sometimes we could be looking at maybe 6 treatments or more. Maybe it could be like a treatment that takes place over the next 3 months, but it's really getting the person back into balance because we don't know what their lifestyles are. Maybe they work a lot, and stress can cause the body to fluctuate so much to where our reproductive organs are starting to take a hit. And then we need to bring that back into harmony.
Yeah. And then on the male side, maybe his sperm count is great, motility is completely fine, but what's the state of his spirit? What's the state of his yang? And that really matters in male fertility. Yeah.
Why does that matter? Go into more detail about that, because I've got friends who, the guys they're not like, they don't know. So like, what can we tell guys to do to prepare for fertility?
Well, male bodies, okay, so when dealing with fertility, the yin aspect, I think we talked about this before, but the yin aspect is very, very influential in the fertility of women. And then the yang aspect for men is more influential for their fertility. So not to say that that's like, like set in stone, right? But for male fertility, that yang aspect, the spirit, the state of his spirit, is just so influential in his actual, virility and okay, so the way that I like to explain it is that I feel like infertility is at an all-time low or high, actually. People are not getting pregnant as easily as they used to back in the day. And I do think there's this kind of cultural and social dynamic that's happening between men and women. Women have had to fight so hard to reach this place of equality, right? And so we're almost there. We're pretty much there. And so I feel like, in a sense, that the male kind of energy spirit feels a little bit threatened by this. And so it dampens their spirit, right? And so women are coming into their power. We're realizing our strength, and we're coming up to meet that energy, right? And so I feel like there is this suppression on the male aspect, on their spirit, that maybe they're not of value anymore. And they're not needed, and which they very much are needed. And so I feel like there needs to be this emphasis on feeling empowered as a man, in that sense. I am able to impregnate my partner and have that kind of coming from the inside, that he is able to actually procreate. And so when I work with men on that aspect, we don't necessarily directly ask, because they're not going to answer it very clearly anyway. Like, how are you doing in that department? How are you doing emotionally? All that kind of stuff. And so you ask him about his his kind of strength in different areas. How's your energy? Are you able to sustain your energy? Are you moving your body? Are you, that kind of question. And then as you kind of work with them, you can kind of gauge the state of their spirit. Are they feeling depressed? Are they feeling inadequate? Are they not feeling as their partner's equal? Are they feeling not involved? And so all of that really comes into play in his ability to impregnate, his virility.
Those are excellent questions, because coming from a Chinese medicine perspective, like we ask those questions in general for people who are coming to us for pain or even stress, because we realize that, okay, we're trying to find the root. Where is there a deficiency that we can correct so that way the body can work more harmoniously? And you're right, men are not going to say, oh, I'm feeling a little sad or depressed.
Some of them do, a lot of them do. But I think for those ones that maybe are not so transparent, there are ways to actually gauge it through tongue, pulse, and just like your 10 questions, that you ask. And just kind of tapping into that intuitive part of, the questions that we ask on a normal basis. Yeah.
And the answers from that will tell us, okay, what kind of, nutrition, diet, herbs can we use to help bring the body back into balance? What kind of practices at home can we do collectively? I just out of curiosity, they call Tantra, sex Tantra relationships. Is there a correlation with what is practiced in that connectivity, that meditation practice? Is that what we would call the exercise in increasing fertility? Is there a connection there?
Yeah, I mean, Tantra is like that practice of that integration, full integration of yin and yang, right? And so, I mean, I guess, it's also like a sexual practice, and it has its nuances. But the same kind of philosophies do intersect. And in order to conceive a baby, you do need both yin and yang aspect. And when conception happens, it's that perfect moment when that connection happens of both yin and yang in that a kind of harmonious balance of connection. And boom, there's a spark of light and conception actually occurs.
Creation.
Yeah.
My heart, so here comes the soul, and boom. That's like the excitement. That's like the crescendo.
Sure, exactly.
Funny. Wow, we can talk about this topic forever, but I want to hold off on any more information because I want people to check out your course. Talk a little bit about, you talk about like the rudiments of, your period and your cycle, because that's really like the foundation, the basic.
Yeah. So for females, we have this thing that connects all of us and that we can relate to one another. And we just know by just being a female with female physiology, what that experience is like. And I feel like a lot of times it's, we focus on the negative aspects a lot, in our culture. And it's not without merit because we've been just kind of taught that through generations and generations, that it's just something that we should hide and something that we should be shameful about and be discreet about and not talk about it. And, that kind of, it influences and permeates into the psyche of a female, that there's a part of them that they should shun and not incorporate into your whole. And it's actually so important to actually integrate that part of yourself because it's a vitally important in your whole well-being. It's a vital sign. And it's a way for you to kind of gauge the state of your health. And so there are a lot of philosophies, not only Chinese medicine, that talk about the menstrual cycle in this very rhythmic and cyclical way. You know, a lot of indigenous cultures, you know, correlated the moon with women, you know, because it is just so tied together. It's not only Chinese medicine. But what I did in this course is I used my experience as being an acupuncturist and herbalist to really try and explain the power in the female cycle that we haven't been taught within the lens of Western medicine and Eastern philosophies, to see how cyclical you are. And every single menstrual month, it's like you have inner seasons. And if you tap into those inner seasons, you know, and you can predict and prepare what your body needs at those vital times, and then tap into vitality. And so you don't become a slave to your hormones. You actually harness, you know, the essence of each phase, and you just know how to ride the waves versus like be a slave to them, basically. Yeah.
I love how you eloquently just communicate that. I also, through you, I have discovered about Steamy Chick, and you also have these herbs that I want to quickly touch on. And because I'm bringing this up because I have a friend of mine who I was on the phone with, and she was FaceTiming me, and she's like, "Oh, look, I'm on my box in her house." Her husband made her a box. And
Nice.
how even though she's dealing with a lot of other ailments, just steaming twice a week has changed her whole reproductive experience.
And so amazing. Yeah.
She gets less urinary tract infections, and she just feels more wholesome.
Yeah.
And so do you share a little bit about that in the e-course as well?
Yeah, I talk about it right at the end about, and it's that whole integration factor, you know, because we haven't been taught this vital self-care. We've become so disconnected with that part of our body, and then we expect it to work and function when we need it, right? And so steaming traditionally has been a way universally all across cultures, all around the world, for women to heal themselves. I know in some countries that's actually the first line of defense after they've been traumatized, you know, like with rape, say, for instance. And it's this way to integrate that part of yourself as this part is important in my overall well-being. And when, I don't know if you've actually tried it, but when you actually sit on the box and you feel the steam coming up, and the sensations that you feel, they might feel kind of new because you're just coming to awareness about how you can actually feel down there, you know. And so there is this really beautiful integration factor of like, wow, this part of this body, part of my body can feel like that. And it does something to the neurons, you know, inside. And physiologically, it increases circulation to the area. And, you know, in Chinese medicine, a lot of infertility or reproductive issues are due to stagnation of blood, stagnation of cold in the uterus. And I know Western concepts don't really recognize that fact, but a lot of the ailments that we actually experience as women these days are due to lack of circulation there. And so steaming is just a beautiful way and such a very non-invasive self-help thing that you can do in the privacy of your own home to increase circulation in that area.
Yeah, I love it. And this is in addition to what a person is doing with their doctor, right? We always want to promote that, right?
Yeah, and honestly, you can share with your doctor, hey, I'm doing this self-care thing at home. It has improved my menstrual cycles tremendously. I'm not getting as many UTIs. I'm not getting as many infections. I'm I have less brown blood in my period. I have less clots. I'm not in excruciating pain as much as I used to be. My cysts have gone away. You know, I have chunks of stuff coming out that look like my fibroids. You know, like you can absolutely share with your doctor the things that you should actually tell your doctor what you're doing. Yeah.
I agree. How are we doing on time? Are you about to?
Yeah, I have a few minutes.
Perfect. Okay. Well, those of you who are watching the replay, I can't stress enough how important Chris's e-course, Feminine Cycle 101, is for anyone who is experiencing challenges in all the departments that we're talking about here. And I have got access, and I'm going through the course little by little and seeing how, even as a practitioner, I'm learning things that I haven't really paid particular focus on, and I'm really enjoying what Chris has to offer. So Chris, again, you know, for those who are watching this replay who haven't seen the other videos, tell us, how can our guest get onto your course like right now?
You can actually post a link if you want to post a link on Facebook, and they can just access it through that way. It's through a platform called CourseCraft. It's very user-friendly. You'll have access to the course for a lifetime, so you can revisit the course as many times as you need. You can even follow along your actual moon cycle. Yeah.
Perfect. Well, you know, we've been spending the last, I guess, 4 weeks together talking about all these wonderful topics. I want to just thank you so much for your time out of your day, and your generosity and in giving us this wisdom, and opening up this like can of worms, this discussion on, you know, that's seldom talked about. And I really do look forward to, you know, looking at some other things in the future. Maybe we can do some more stuff. But no matter what, I am wanting to get this course out there. I want people to see how important it is, and you know, maybe one day they won't need to go to the doctors as often because of the wisdom that you're sharing and which you have shared with us already. So, thank you so much, Chris, for your time. You are amazing.
Thank you so much.
Wonderful. Do you have any closing comments that you want to share with our viewers before we wrap up this series?
I guess the takeaway is that you have the most profound medicine right inside of you.
Great. All right. So much, Chris. Bye, everyone. Thanks so much for watching, and check out Chris's e-course, and you'll see me again here on live TV at Anthony Pichinell, that TCM chick. So we'll see you on another broadcast. Thanks for joining us.